Good morning and welcome to today's video. So I have just had my morning walk and I have gotten myself a bit like I am not feeling a lot of pains. I have not started lifting a lot of things after the operation. I just take long walk morning and evening so that it will heal. And there are so many other things that I'm also doing to facilitate the healing process, which I'm going to share with you in another video. But this video today is just to answer some of your questions. I've had a lot of people. Okay, the first question, or the frequently asked question that people has come into my DM, sent me messages to ask, is if it is safe to remove your fibroids. Before I answer that question, I want to ask you also a question. Is the fibroid disturbing you? One of the questions you have to ask yourself is, if the fibroid is disturbing you, is giving you a lot of pain, you are bleeding. When I mean bleeding, maybe when you see your menses, it bleeds and you bleed without ending, and at the end of each of your menstruation, your cycle or your period, you have to take medicines, blood medicines and things like that. The second thing is this: how big is the fibroid? What is the position of the fibroid? Where are the fibroids located? And the last question you also want to ask yourself is, because we all know that fibroid grows, it grows back after a few years, it will grow again, especially if you don't change your diet and if you're not careful about what you eat. So you want to ask yourself, what is my position now in life? Like, are you married? Are you single? And can I afford it now? These are the questions that you have to ask yourself before you go into the surgery, before you decide that you want to get your fibroids removed. So if you are having pain, a lot of pain, go for it. That is my advice, because fibroid pain can be very, very painful. If you are seeing your period and you have fibroids, it's painful. It is very, very painful. So if that is your situation, that every month you have pains, when you make love you have pain, when you move, when you do some certain things you have pains, so go ahead and remove it. But if you are still young, you are not married, the fibroids are just there, you can control what you are eating, and you plan that in the future you are going to get married and have kids, I don't think you should remove the fibroid yet. I don't think you should remove the fibroid yet. And I'm going to tell you the reason why I feel that you shouldn't remove the fibroid yet. The reason is because the fibroid grows back. Okay, if you live in diaspora like Germany, in all these developed countries, there's a way to also remove fibroids without it hurting so much. Very, very easy. The one they enter through the VJ and they just take it out. That one, after 3 or 4 days, you get yourself, you go back to work. So it's not like an open surgery that they have to cut you open and stuff like that. That one, sometimes 30 minutes or few minutes, you are done, and that is it. So they don't have to stitch you, they just go from VJ and remove it. If the fibroids are just like that and they are disturbing you, you can remove it. Okay. Now, another thing is, if you are married and you feel that you are facing what is called infertility, just like my own case, and you want to take them out, you can do that. You can do that. If you feel that the fibroid is contributing to the infertility, or that is the main reason why you have not taken in, or you have been having miscarriages just like me, so what you need to do is to remove it. And once you remove it, and you try for months, try cleaning up yourself, and then you try for months and it doesn't enter, the next thing to do is to go for IVF. because this is why I say you should go for IVF, because you don't need to wait just in case the fibroids grows back, because it grows back. So what you do as a married person, once you remove them, just go ahead and look for every possible means to have your kids before it starts growing up. The thing is that even after you've had your kids and you have removed them, maybe it will not even grow, because I just believe that estrogen is produced a lot by women who are in their ages of giving birth, who still have their eggs, and they have this hormone that wants to get pregnant, you know, because that is what the womb is there. The womb is there just to have babies. So when it is time, they produce egg, they are waiting for something to come in and they don't come in. I just feel that that is the reason, you know, it expects and it produces estrogen, and that estrogen does not have anything to do work with, and then at the end of the day something shall happen there, and then it becomes fibroid. If you can afford it, please remove it. If it's disturbing you, remove it. If it's not disturbing you, you don't need to remove it. It's not cancerous. It's not people even have big fibroids, and they still go ahead and use it to have kids. So everybody's case is not different. So you have to consider your case. If you have pains, if you want to have children and you feel that the fibroid is the problem, you can go ahead and remove it. Okay, so but if you don't have issues, you just know that you have fibroids, they are there, they're not giving you stress, they're not giving you pain, they are not disturbing you, there's no need of removing them. There's no need. This is the third one. This third one that I removed, I didn't know I was even going to remove it. It was because I was able to get pregnant even with the fibroids. Okay, even with the fibroid, I was able to get pregnant. But the problem is that the pregnancy was not able, or the pregnancies does not stay. And my own case is different. Like I said, there are different types of fibroid. There are ones that are outside the womb, there is the one that's inside, there are the one that's at the wall and stuff like that. So you have to know the position. So if you're having you are just having kids and the fibroids are outside your womb, it doesn't disturb you. You can still have your normal children and it will not disturb you. It's just there. Okay, the ones that are very, very dangerous, or the ones that are very, very disturbing and annoying, are the ones that's inside the womb. Just like my case, the ones that you have inside your womb, and they are there. Like in my case, I had two inside. So once I get pregnant, the pregnant start growing. The types of fibroid that I had were the ones that are very, very aggressive. I'm going to, maybe on this video, I'm going to tag, or I'm going to drop a picture of me when I was 2 months pregnant. My stomach was so big. The fibroids grew from 2 centimeters to 7-8 centimeters in 2 months. Yes. So my stomach was so big. The fibroids were so big. So the fibroids were growing 3-4 times faster than the babies. And they were pressing the babies. That is what happens. They are pressing the babies. Babies don't have space to develop, because they are getting bigger and bigger and bigger. And when you press my stomach, you feel the fibroid, you feel how big, how massive they were. These are the ones that are outside the womb. The ones inside the womb were still growing. So in that situation, there's nothing you can do than to remove them. And there are procedures that are very, very simple these days. You can go through and then you remove them. Okay, so my answer, I don't know if I've answered your question. If you are asking me, for those of you asking me, can you remove your fibroid, is this safe? It's safe. It's safe. Okay, it's just that, I don't know, depending on the country where you are, if you are going, make sure you go to good doctors and you make inquiries about the hospitals very, very well, and the surgeons very, very well, before you allow them cut you open, so that it doesn't damage other things. Okay, so guys, that is it, and I hope you enjoyed this video. I'll keep you updated as I go. Anytime I have strength, I will do more videos. See you guys and have a nice day. Bye.